All right, Diltiazem, or Cardizem as it's commonly known by. It is a calcium channel blocker and a class 4 antidysrhythmic. The way it works, it inhibits the influx of extracellular calcium into the myocardial cells and the smooth muscle cells. So it inhibits cardiac and smooth muscle contraction, and it also dilates arteries. It acts mostly at the AV node, but also has some effect on the SA node, which will slow conduction. Pregnancy class 4 is C. Indication, AFib or A-flutter with a rapid ventricular rate, that RVR. Another indication is stable, narrow complex tachycardia, secondary to vagal maneuver and dizzying treatment. So if you tried vagal maneuvers, tried adenosine, didn't work, then you can move on to Cardizem. It's not a first-line treatment for stable, narrow complex tachycardia. Contraindications: second or third degree AV block or sinus node disease, compensatory tachycardia or drug/poison-induced tachycardia, and then AFib or A-flutter with Wolff-Parkinson-White syndrome. So those are contraindications for it. Some adverse reactions we want to watch for: dizziness, weakness, headache, dyspnea, edema, dysrhythmias, heart failure, bradycardia, hypertension, syncope, VFib or VTAC, chest pain, and some nausea and vomiting. So a lot of adverse reactions we want to keep an eye out for. Some drug interactions that we need to be mindful of: IV beta blockers will act synergistically, decreasing cardiac output. And then use caution if you're giving that with any other cardiac contractility meds. Anything else that's going to depress the cardiac drive, we want to use caution with. Typical adult dosing, 0.25 milligrams per kilogram, IV or IO slow push, and then if necessary, you can rebolus that usually after about 15 minutes. Pediatrics, don't really give it for the kids. Duration of effects starts working in about 2 to 5 minutes, peak effects in 7 to 10 minutes, and then it lasts in the body for 1 to 3 hours-ish. So something to keep in mind, this is a calcium channel blocker. It does not actually affect serum calcium levels in the blood. So keep that in mind. If you're in a hypercalcemic state, it's not going to change that. You're still going to be having too much calcium. And you may notice some transient dysrhythmias during administration, so just watch for that, like we mentioned in the adverse reactions.